People taking these GLP-1 medications, they're shrinking rapidly, but the scale is actually lying to them about what they are really losing.
It really is.
Yeah, so today we're diving into a massive stack of recent clinical trial data, plus some geriatric health reports, to basically cut through the noise.
Exactly. We're looking at what this data actually means for you if you're in your 60s and 70s. Our mission for this deep dive isn't just about analyzing weight loss, It's really about exploring how to maintain a vibrant, independent life. But hidden in this data is a pretty massive mistake people make with these medications.
Right, and it's wild because that has nothing to do with the drug's chemical makeup itself. We'll get to that hidden flaw in just a second, I promise. But first, since most of our listeners probably already know these are gut hormones, let's look at what the synthetic versions are actually doing differently. I like to think of GLP-1 like an internal traffic cop for your digestion.
Oh, I love that analogy. Because natural GLP-1, it's just a natural hormone that signals fullness to your brain. It regulates your blood sugar and slows down stomach emptying. The prescription medications simply mimic this natural process, just under medical supervision.
But looking at the medical data, your body's natural GLP-1 clears out in minutes. These drugs, they stick around for days.
Days, yeah, exactly.
So it's basically like taking the body's natural fuel gauge and just hacking it to permanently read full.
Right, and that hacked fuel gauge is the core mechanism driving the results. The synthetic version binds to receptors in your brain and simply doesn't let go, virtually eliminating the desire to eat.
If it just mimics a natural hormone, why is it making headlines absolutely everywhere right now?
Well, the benefits are pretty straightforward on the surface. Users just eat less, you feel full sooner, and you often see improved overall health markers across the board.
See, I have to push back a little here. That sounds a bit like a magic pill for weight loss. Surely it's not that simple.
No, definitely not a magic pill. It drastically slows down gastric emptying, which, by the way, explains the severe nausea and vomiting everyone talks about.
Oh, well, yeah.
Right. When food just sits in the stomach for hours instead of moving through the digestive tract normally, it creates this severe biological backlog. And I always stress that the medication will fail long-term without the foundation of healthy eating, daily movement, and good sleep.
Which makes sense. The weight loss numbers in these trials are staggering. But wait, if this drug works by essentially forcing your body into a massive calorie deficit because you physically can't eat, isn't the body going to panic? The brain has to think we are starving.
Yes. And that is the exact mechanism driving the hidden danger we teased earlier. This brings us to the big issue. When you eat significantly less, what exactly is your body losing?
Right, people aren't just losing fat.
No, they're losing vital muscle. When calories plummet that drastically, the body doesn't just quietly burn fat. It scrambles to survive by scavenging for energy.
Wait, really? It goes after muscle?
It does. Because muscle tissue is highly metabolically active, meaning it takes a lot of calories just for your body to maintain it. The body targets your muscle first to conserve energy.
Man, which is just catastrophic if you are over 60.
Yeah.
I want you to think about your own daily routine for a second. How crucial is your balance and strength right now?
It's everything.
It really is. Getting up from the floor, carrying a bag of soil in the garden, catching yourself if you stumble on a curb. We aren't just talking about looking less toned. We are talking about stripping away the biological armor that keeps you independent. Losing muscle is like slowly removing the foundation of a house.
That is a perfect way to put it, and the clinical data backs that up. Up to 40% of the weight lost on these medications can be lean muscle mass if patients aren't actively intervening.
40%, that's huge.
It is. For older adults, losing that much physical strength that quickly accelerates frailty, the medication creates the deficit, but you have to force the body to keep the muscle.
So the real intervention here isn't necessarily avoiding the medication if your doctor says you need it. It's completely changing the foundation underneath it.
Exactly. Adults over 50 absolutely must prioritize adequate protein intake and strength exercises. If you're eating a third of what you used to, every single bite needs to be packed with protein.
Right, to maintain that independence and mobility. And you have to engage in resistance training to signal to your brain, hey, I'm still using these muscles. Do not break them down for fuel.
You have to give the body a mechanical reason to keep that tissue around. It's really about shifting the focus away from a hollow number on the scale and toward better energy, mobility, and your overall quality of life.
Absolutely.
And of course, always consult your healthcare provider to map out what fits your unique medical history.
So true. We actually want to turn this over to you now. Have you been focusing on healthier eating, taking daily walks, or building better strength habits?
Yeah, please share your journey in the comments below. We read all of them, and we'd love to hear what's working for you.
And if you found this deep dive helpful, please like, subscribe, and turn on notifications. It really helps us continue bringing you trusted, practical insights for healthy aging.
Thank you for being part of this community. Remember, whether you use medication or not, sustainable health is never a single solution. It's just a collection of small, everyday choices.
Beautifully said. And as we wrap up, I will leave you with this. Right now, these medications are a blunt instrument. They reduce everything across the board. But as we look at the next generation of pharmacology, the real question isn't whether a drug can make us lose weight. It's whether future versions can be engineered to specifically target fat receptors while completely ignoring or even enhancing our muscle tissue. Until science catches up to that reality, keep a very close eye on your protein.